So once you have this image, you can ask the AI models to either predict the clinical outcome, you can say you can predict the grade or stage of the disease, or you can ask the model to identify the region of interest where you are excited about, because now looking at the whole slide images could be difficult in the microscope. So if you could find the region of interest where the pathologists have to focus on, this will be one of the game changer in that sense. And another interesting aspect one can do once you have this old slide images is to predict the molecular features from the diagnostic slide images. So this is very interesting because given the whole slide images, you, as a pathologist, possibly you will only be looking at the morphological patterns which could give you the clinical diagnosis like stage of the disease or subtype of the disease, but getting into the what is the molecular change that can bring about morphological changes in the tissue slide is something which possibly can only computer vision style of models can do. So this is where one of the area where we are putting a lot of energy into understanding the relationship between the tissue images as well as the genomic changes that are happening. The another interesting thing what you can do is you're taking these images, you could also try to do a risk prediction model to say whether understand the survival probability of these patients by stratifying them into low and high risk groups. So these are things which possibly becomes a reality once you have the digital image in your hand and you are using computers to help you in guiding you through certain tasks which you routinely do in your lab. And there are also several other things one can do. It could be virtual staining, so where you use some of the antibodies to stain. So the computer vision can identify those cells which are possibly not visible without help of an antibody or any other markers. Or you can also look at the morphology of the individual cells, which possibly also kind of adding to the cognitive overload which the pathologists are encountering. So several such tasks can be enabled once you have this digital slide images. So, but then what we are doing in the space is just what I'm going to discuss in next few slides is the journey from building data sets to the models. So this is where, given that I spoke about digital pathology being very important, and now the question is where is the data lying in India to do such kind of work, right? So and this is where we took a cautious effort 2 years ago to build this data sets, and this is what is called Indian pathology data sets, which we are trying to curate by collaborating with various hospitals in Hyderabad and in other parts of India to build up this data set specifically in oncology, and now we are expanding into other areas like lupus nephritis and etc. And once you have these data sets, now you are going to ask what kind of insights that we can derive out of this Indian oncology data sets. So I'll show you one use case that we could derive, and that's what I'm going to discuss. So that's one is called IPD brain. This is the Indian pathology data sets of brain data, which we recently released for public use. So anybody who are interested in using this data sets can now start using it. And this data set comes with not only the images, but it also comes with other clinical information associated with that image that could include clinical diagnosis of the radiological reports, as well as you'll also see some of the ISC markers that have been quantified for that particular patient is also being tagged with this data sets. And once you have such data sets, now you could build several such models which you are interested in. And one such entity that we were trying to build was to understand various subtypes of gliomas which are important for the final diagnosis. So in that sense, you will see that this is when once you have constructed the data, now you have this kind of machine learning models that can be constructed. And there are different jargons you could come across in the machine learning paradigms, from supervised learning to unsupervised to reinforcement learning. But none of these parts are being used in our context because the kind of information that we have with the slide is not sufficient enough to build the whole supervised learning framework. This is where you have the labels of the data and use those labels to build the model as input-output information. But what we are trying to use is called some kind of what is called weakly supervised approach. Possibly the technical details are not important here. Here what we are looking at is what we have is we have the information of the slide, whether it's tumor or not. Whereas where exactly the tumor is localized within the slide, that information is not here. So we are using only a label which says the slide is tumor or not. So with that information in hand, how can you build such models which could possibly predict any of these outcomes that you are interested in? And one such framework that we adopted in this understanding, because asking doctors to annotate those images is going to be one big challenge, because the data sets that we curated is one aspect of it. but annotating those data sets for building a robust AI model is also another gigantic task that we are being faced up with, right? So how do we deal with the availability of the data as well as the annotation that comes with the data?